Rural healthcare is in crisis nationwide. Dozens have closed. Here in Nebraska, many are barely able to make a profit, let alone keep their doors open. 3 News Now investigator Jeff Van Sant has more on the struggles these facilities face.
Yeah, we've traveled to some of these rural facilities to get a sense of the challenges they face, how vital they are to their small communities, providing care on a shoestring budget. Nebraska is vast, mostly rural. Services can be tough, limited, especially healthcare. Small facilities running on shoestring budgets, providing so much to so few. In the southwest corner of the state, near the Colorado-Kansas borders, is the tiny town of Binkelman. Population less than 900. One of the biggest employers, the Dundee County Hospital.
I mean, my parents lived here close. Our town is just like one big family.
Rita Jones is the CEO.
Some people look at us and they think that, we're not a big facility, but we're a great doorway to large facilities.
The hospital has a small staff, over 20 nurses, 2 doctors, 2 nurse practitioners. Most live in the community.
You're being taken care of by your neighbors and your friends when you're in the rural healthcare system.
The facility itself is small.
That's my lovely nurses working their hearts away.
Lycan Verbus is the chief nursing officer.
My girls will tell you they do it all. It's very stressful, but I hope very rewarding in the end.
Small hospitals like this do what they can with what they have. It's tough, from funding to recruiting.
A lot of people are like, we're not going to work, we want to go somewhere big where they do lots of stuff. And here you get it all. You get to see babies, you get to see people in their last minutes.
The nearest comparable facility is 38 miles away. A much larger hospital is even harder to get to. It's about a 50-minute helicopter ride to Denver. Like so many rural facilities, it's a struggle to stay afloat. This year, it's operating at just over 1% in the black. Jones says changes brought on by the Affordable Care Act saw around $350 million in cuts to hospitals and physicians to pay for expanded care under the new law, as well as the federal government sequestration, which caused a 2% cut across the entire federal budget.
They're just taking little whacks at it, and it's not a good thing. If they continue, there will be a lot of small facilities that do not survive.
She pays close attention to what's happening on the national stage, knowing funding or regulations can change, and change quickly.
The previous 4 years, we have lost ground significantly. We've lost probably about $300,000 a year on our balance sheet.
According to the Nebraska Rural Health Association, there's 71 rural health facilities in the state. 39 are running on an operating margin of just around 2%. 29 are running in the red. The Dundee County Hospital is managing to stay afloat, thanks to donations from local companies and the county. It's even expanding. This $3.8 million project is entirely funded by donations. While the facility is fighting to stay in the black, changes could be right around the corner.
Some days you just have to be happy that you're holding ground and that you're able to keep the services. It's wonderful when you can grow, but sometimes you just have to be happy holding ground.
So we're continuing to look into struggles facing the rural healthcare system, from budgets to personnel, the way these facilities can stay afloat. Reporting live in the studio, Jeff Van Sant, 3 News Now.
Thanks, Jeff. You can see all the stories the investigative team has worked on, including part 1 of the rural health investigation. That's on our website, 3newsnow.com. And if you have a story you'd like the investigative team to look into, email them at investigate@3newsnow.com.